Hematological disorders. Malignant lymphoma basically refers to a group of disorders characterized by malignant proliferation of lymphoid tissue, usually presenting as lymph node swellings. There are two major histological types, distinguished by the presence or absence of the Reit-Steinberg cell. And the two main groups are Hodgkin's lymphoma, with its RS cell present, and non-Hodgkin's lymphoma, RS cell is absent. That's a Reit-Steinberg cell. No age is exempt, although generally the incidence of non-Hodgkin's lymphoma increases with age and immunosuppression, while Hodgkin's lymphoma shows a bimodal peak in that there is a high incidence in the third and seventh decades. Beckett's lymphoma, which is a subtype of non-Hodgkin's lymphoma, is one of the fastest growing tumors known in man, and there are three clinical variants: the endemic, sporadic, and immunodeficiency associated forms. The endemic form is usually found in tropical and malaria endemic regions like Ghana, and commonly presents as a jaw swelling with loosening of the associated teeth. Is one of the commonest childhood malignancies, and it has a peak age incidence at 4 to 7 years with a male preponderance. Causes are often unknown, as usually associated with etiological agents like chronic antigenic stimulation by Helicobacter pylori infection in gastric lymphoma, and also viruses, for example, herpes virus, AIDS, Epstein-Barr virus, and HTLV1, and also chemicals like pesticides and herbicides, and wood dust. Symptoms include lymph node swelling, which may wax and wane, and also jaw swelling in Beckett's, and fever may be present, night sweats, weight loss, easy fatigability, and abdominal distension, intestinal obstruction in abdominal lymphomas. The signs that are usually elicited are firm, rubbery, non-tender lymph nodes, splenomegaly, superior vena cava syndrome in bulky mediastinal masses. That's if bulky mediastinal masses are present, and also pallor if marrow has been involved. Investigations are lymph node biopsy, as of a significantly enlarged node, and fine needle aspiration in Beckett's, and FBC, that's full blood count, and blood film comments, chest x-ray, abdominal ultrasound scan, CT scan when necessary, and also bone marrow aspirate and trypsin biopsy. Treatment. So the main treatment objectives are to provide a cure, and also to provide supportive treatment as pain relief, transfusion, support, treat infections, and counseling. Non-pharmacological treatments include ensuring good hydration, counseling, and education. Pharmacological treatment for Hodgkin's lymphoma and non-Hodgkin's lymphoma. The first line treatment, normally supportive treatment is being given, like pain relief, but avoid NSAIDs, that's non-steroidal anti-inflammatory drugs. Also packed red cell transfusion and platelet transfusion when indicated. IV and oral fluids, and also allopurinol to mitigate tumor lysis, and treatment of infections too. Specific treatments are available at specialized tertiary centers only. Referral criteria: so all patients should be referred to a hematologist at a specialized tertiary center.